Hi, I'm Dr. Ghalambor and Bob from NorTex Spine Joint Institute talking about shoulder impingement syndrome. So, the shoulder is a tight joint. There are a lot of tendons, muscles, and ligaments all jammed into a small area with a roof called acromion. Now, if the roof is like this, you can have a little bit more space, especially if stuff in that space gets a little swollen. But if you have the roof that is like this, so it depends on type of acromion you have, we call it type 1, 2, or 3, the more the number, the more jammed the space is below the roof and the acromion, and you're more prone to get impingement. Now, this happens a lot of times when you have people that have jobs or activities or sports that have above the head type of position for a long time, like painters, sports, racket sports, swimming. Also, if you have the bad habit of sleeping on your arm or have the arm being above your head, which I used to, and therefore I used to have impingement syndrome, that can happen as well. So, of course, rule of thumb, don't aggravate it. If it's aggravated, the problem is you have inflammation in this tight space. Inflammation then would mean that inflammatory cells and water would come in and swell up. If it swells up in a tight space, well, it pushes on the other structures, and the other structures will then in turn get inflamed, and then they will push back. Now, the key is we need to quickly turn off that vicious cycle. So typically we want to give it rest, want to give it anti-inflammatory medication. We want to make sure that we don't irritate it again. But, what you're taking, very small amount of it will eventually reach this area. So the best course of action if you have a flare-up is to do an injection. Now again, you want to get the injection under fluoroscopy or ultrasound guidance with a provider that is experienced in these type of procedures. So I would strongly recommend you to see fellowship trained and board certified interventional spine and joint specialist, which otherwise are known as interventional pain management people. Get into under the roof, which is the subacromial bursa, and inject steroids to calm down that inflammation first. And once that is done, then you can continue your rehab and other preventative measures to hopefully not irritate it again. There are some people that unfortunately, despite how hard we try, they would eventually need a surgery, and that's what we do here at NorTex. We work closely, hand in hand, with very good local orthosurgeons, spine surgeons, and we team up with them as a multidisciplinary clinic to help you with your spine and joint problems. Thank you so much for watching.